Hi everyone, I'm Mallika Marshall. I'm a medical reporter for WBZ-TV and CBS News Boston and a practicing physician at Mass General, and I will be your moderator today. We have joining here in person, to my right, Skyler Johnson, who's assistant professor in the Department of Radiation Oncology at Huntsman Cancer Institute and University of Utah School of Medicine. To his right, we have Stacy Loeb, who's professor of Urology and Population Health at New York University Langone Health and Manhattan Veterans Affairs. And joining us remotely, we have Milagros Abreu, who is president and CEO and founder of the Latino Health Insurance Program, Inc. Now, this event is actually presented by the studio jointly with the Zhu Family Center for Global Cancer Prevention at the Harvard Chan School, just in time for World Cancer Week. So I'm going to throw out the first question, and a lot of us consult Dr. Google when we're looking for health information online, and there can be some very reputable information online, but of course there can be information that is confusing and outdated and potentially harmful. And of course people with a cancer diagnosis may be particularly vulnerable to this type of information. So I'm going to ask each of our panelists, starting with Skyler, what concerns you most about cancer misinformation?
The thing that concerns me most about cancer misinformation is how it can appear reputable. I think what the challenge many patients have is being able to discern what is accurate and what is inaccurate information online, because it can seem, like it's accurate information that people should be following. Many of us who have had experiences with family members, for example, who've had cancer, have probably gone online themselves to look up information. I think fortunately, for those who have a high level of medical literacy, you can discern what's accurate and what's not accurate. But unfortunately, there are many individuals who may not be able to distinguish that difference. And for those individuals, my concern is that if they follow that guidance, it can impact their chance at a cure.
Stacy?
Yes, so I think that what concerns me most about online cancer misinformation is how prevalent it is, how popular it is, where in many cases there's actually more engagement with the worst quality information about cancer, and how much harm it can potentially cause for people, where it may deter people from undergoing important screenings or treatments for cancer.
And Milagros, what concerns you the most about cancer misinformation?
I think also talking about vulnerable populations that we are talking today, people who's been diagnosed, and especially when we're talking about individuals from diverse cultures and beliefs. So we wanted to be cautious with the information and the sources that we are getting. And for us who will try to improve health literacy and education for these individuals, these online or maybe other sources can really be harmful for these vulnerable population, in this case, people with the diagnosis of cancer.
Now, Stacy, you in particular have actually been studying how misinformation spreads through online networks. Can you tell us about the different kinds of cancer misinformation that are out there?
Yes, so that's a great question, and unfortunately we are seeing a huge amount of cancer misinformation about a wide variety of topics, all the way from causes. For example, there's online posts suggesting that prostate cancer is sexually transmitted, or perhaps not ejaculating frequently enough or too much causes prostate cancer. There's myths about screening, a lot of even about symptoms. For example, there's lots of posts out there saying, early warning signs of prostate cancer. If you see blood in the urine, if you have bone pain, these could be early warning signs of prostate cancer. But that's not true. Prostate cancer doesn't have any symptoms at an early stage, and that's why screening is important. In fact, those are very late symptoms of advanced prostate cancer. So this is concerning because somebody could think, oh, I don't have any of those symptoms, I'm fine, I don't need to worry about this. Or conversely, somebody sees one of these posts and it says waking up at night to urinate could be prostate cancer and they're panicked, but most likely that's just from enlarged prostate, which is totally benign, not cancer at all. We also see a lot of misinformation about cancer treatment, nutrition, supplements, survivorship issues. You can't have sex after cancer treatment. So really, from the beginning to the end, unfortunately, really spanning just about every topic.
I do a lot of medical reporting, and so I'm constantly having to debunk things that people have heard on social media, in particular Instagram and Twitter. And I have people in our newsroom who I hear them chatting with each other about, oh, did you see this thing on TikTok? Did you see this? How widespread is this problem, and is it getting worse?
So it's really widespread. We started out looking at YouTube. We looked at a few different types of cancer, bladder cancer, prostate cancer. And, among the content on YouTube, there were a substantial proportion that had misinformation for both of these. And if you look at these posts, they were seen by millions of viewers. So the misinformation had a really wide reach. And then we did a deeper dive on prostate cancer, beyond just YouTube. We looked at Instagram, TikTok, and across those three platforms, about 40% of the content that had any kind of objective information had misinformation or some kind of inaccurate information. We also looked at podcasts and Pinterest, and there it was more around like 13%, so not as high, but still substantial. So, bottom line, this is not just a problem for one cancer type or one network. This is really a pervasive problem, and if left to somebody's own searches, there is a very substantial risk that our patients could be exposed to some of this.
I thought people only went to Pinterest for decorating and baking ideas. It never occurred to me that that kind of health information would be on Pinterest. Skyler, do you have anything to add?
Yeah, we've done some very similar work as Dr. Loeb, and one of the things that we've done is look at the most popular cancer articles on social media like Facebook, Twitter, Pinterest, and Reddit, and the findings really mirror similarly what Dr. Loeb was just mentioning, that usually about 1 in 3 of the articles contain misinformation. We looked at this closely, and if you look at the articles that have misinformation in them, the vast majority of them contain harmful misinformation, things that are telling people don't get chemotherapy, things that are telling people don't have a biopsy, don't get screened, avoid treatments that have evidence to support their use. So that was concerning, because it was not just that these things were false or misleading or myths and misconceptions, but they were harmful. Interestingly as well, we looked at the engagement that these types of things received online, and these articles that were false and harmful received more engagement than articles that were true and safe, similar to what she was saying earlier.
So it's not just things like you should eat more pickles or you should go to sleep at 8 o'clock at night. Like, these are really life and death decisions that people are making based on the information that they're seeing online and trusting.
Exactly.
Milagros, what about receiving health information from well-meaning but misinformed people? We all have family members and friends who have come to us and told us to do this, that, or the other thing. Is that a big problem as well?
Definitely. I also wanted to add an article that I was participating that is called Cultural and Patient-Physician Relationship, Achieving Cultural Competency in Healthcare. Why this is important? Because the normative values, so the belief that when we see a patient, will be important to understand. So how we can improve the patient communication can reduce the patient's go to rely on other sources and focusing on the information that they receive from their providers. An example about those normative values, I'm just going to give you the definition. Normative values are defining the belief, ideas, and behavior that a particular culture or group values and expect in interpersonal interactions with their providers. So there are different types. I'm just going to talk about one of them in particular that is called fatalism. The fatalism, so as we know, some patients might say that cancer is the end for them. So we understand that for some patients, the misinformation or the misbelief or misunderstanding about their condition, they can determine that they can go in another sources, family members, relatives, instead of going to the right sources. So we try to understand that in those cases, fatalisms can mean for them that that's it, I have cancer, there is nothing else that I can do. So I can go to somewhere else for information to see these other treatments can help me. And then they can rely on folk medicine or different kind of other ways to cure their conditions. So we need to understand those differences in the people and the patients and the different cultures, not that we're going to try to getting all this information for the diversity of the population that we are serving, but at least for the patients that are more commonly seen in our practices. Because if we giving them sources of right sources of information, educating them, improving their health literacy, they can become our partners in care. So I want also to mention some of the misinformation that can be turned based on their family members, and that's why it's also important for us to engage not only the patient in the care, but also the relatives or the close people in their environment, because sometimes these are the one to helping the patient to make the decision. So it is important to understanding the diversity of the cultures and also to understanding those normative values that can help us to improve communication with our patients so they can reduce the unnecessary rely on other sources, even their own family members or friends.
I think those cultural factors are so important. I work predominantly with Spanish-speaking patients in my urgent care practice, and I definitely have experienced that sort of fatalism, that throwing the hands up, well, you know, it's God's will, that's what's going to happen, there's nothing I can do about it. So it's really important to keep those things in mind. Thank you for providing us that context. Skyler, you touched on this, but what is the danger of misinformation in someone choosing an unproven or disproven cancer treatment, or maybe avoiding treatment all the time? What have you found in your experience in terms of people selecting alternative treatments and not choosing standardized care?
Yeah, I think apologies. Very early on in my clinical practice, I noticed patients were making these decisions, and it was hard because you would see them back later and their cancer would have spread, or it would become a point where it would not be curable and they would die. And that's a hard thing as a physician to witness. But that was anecdotal. I mean, these were things that we were just seeing, and there was not a lot of great data to support one perspective over another. Interestingly, we were able to study a large group of individuals in the United States who were using unproven and disproven cancer treatments to compare their outcomes to individuals who were using the physician-recommended cancer treatments for their curable cancers. And we looked at the most common cancers. And in these groups of individuals who were using unproven and disproven cancer treatments, they had up to a 5-fold increased risk of death depending on the cancer that they have. And that's concerning, right? Because these are individuals who could have received an evidence-based approach that would have provided a better chance of a cure.
Can you give us some examples of what treatments, alternative treatments, sometimes people are turning to?
Yeah, so you can see a wide variety of approaches, and you can think about these things in really granular ways, but in a broad perspective, you can think of them as being treatments that are like herbal remedies, vitamins and minerals, natural supplements. I try to distinguish what is maybe non-traditional therapies that might include mind-body therapies that are actually helpful for people to get through the difficulties of a cancer treatment. So things like meditation and exercise, great. Those things are great. You have strong evidence and support for them. But there's a lot of things that don't have evidence for their use. And when you use them instead of proven cancer treatments, you put your health at risk. The other concerns are that sometimes if you use them combined, it could potentially make the cancer treatments more toxic or less effective depending on these interactions that they have. There's also indirect concerns or indirect results of these therapies. Sometimes patients will do really extreme diets and they'll cut out all sugar from their diet and they'll lose a lot of weight, and we have to interrupt their chemotherapy so they can get nutrition advice or even feeding tubes. And in interrupting their chemotherapy, they put their cancer cure at risk. Again, it's something that you'd think would be unrelated, but can impact your chance at cure.
So can you both talk about what we can do to combat some of this misinformation?
Well, I think it's really going to have to be a multidisciplinary, multi-stakeholder effort just because of the nature of the problem. I can say as a healthcare provider, one thing that we can do is to give our patients an information prescription. So that is to say, not just prescribe drugs or treatments, but also to prescribe information, because we have to be realistic. There are time constraints to the clinical encounter. There is never going to be enough time for everything that we could possibly want to discuss, and people are going to want additional information. So instead of releasing them into this, quote, wild west, to navigate themselves and identify information, all of us in a particular specialty know a lot of good sources, and we should be proactively telling our patients. And likewise, for any patients that are listening or family members, if that is not being done at your visit, ask the clinician, what are some good sources of additional information? And then just basic tips to look out for, like when did the information come from? Thankfully, there have been so many advances in cancer over the past decade, so it's great news. We have so much more hope than we did, but with these advances, there's changes in screening, changes in treatment. The guidelines are continuously being updated. So if you're looking at something that was from 10 years ago, 5 years ago, everything keeps moving on. And so you do have to be really careful, not just about the source, but about the date of the information.
I think I am actually today will be reporting on this new home urine test for prostate cancer, apparently that researchers at your institution, I think, have been involved in. So I try to impart reputable evidence-based information to the public. I try to do my part on television and one-on-one in the clinic. But give me a sense as to what this information prescription would look like. Are you literally writing down on a piece of paper, go to this site, go to this site? What are you telling them?
Yeah, exactly. So, there's different ways to go about it. Many institutions across the United States, for example, use electronic medical platforms like Epic, and these often will have a place for you to give an after-visit summary to the patient. So that would be a location that you could indicate sources of information. There are also platforms that physicians can sign up for where you can create your own pages that actually have all of your favorite references and sources about each of the conditions that you treat. And so that is another place that health professionals can go to actually just essentially create their own clearinghouse of what they think are the best sources for patients and families to read about different health conditions. So however you want to go about it. And then just what you're doing, and I have the same thing. I've been hosting the Men's Health Show on Sirius XM for, 13 years now. And I think it is very important for physicians and scientists to engage in public media activities. We have to be a part of the conversation and helping to disseminate evidence-based information about health in the broader community. I actually would say it's an imperative. So thank you for what you contribute.
And I just want to correct myself because I think I'm talking about several stories this evening, but I think one is an autism story out of Langone, and the other one might have been out of Vanderbilt and the University of Michigan. But again, important cancer screening information to pass on. I think we learned a hard lesson over COVID that for people who were very skeptical about the vaccines and about getting testing and all that stuff, that it wasn't good enough just to say, no, you're wrong, listen to us, we know the right information, you need to do this. What lessons have we learned from COVID on how to talk to people about things that they might have stuck in their head, but trying to unravel it and trying to get into them important information that could save their lives?
Yeah, I think some of that comes really early on, or at least should come early on in our education of our population about how science works. There is this evolving nature that occurs in the information ecosystem, and that is a feature of the science. It's not a bug, and a lot of the patients that I encountered during COVID who were frustrated with the communication surrounding the science were upset that things were changing and evolving. And again, that's the nature of science. As we learn more, things are going to change. So, we have to do a better job of at least educating early on so people are aware that that is a normal occurrence with science. We learned a lot of other important lessons through COVID, and I think they apply to cancer as well, is that people really are drawn towards certainty. They don't want to hear about a vaccine or a treatment that only has a 70% effectiveness. They want certainty.
Even though in the scientific community, that's actually pretty good,
yeah,
right?
And
right.
So that becomes quite a bit of a challenge because when you're a cancer patient, I imagine that there's a lot of vulnerability that comes along with that, a lot of anxiety, and with that uncertainty, you want to find something that's going to be potentially maybe even like a magic bullet, and I think that's where people become prone to being following some misinformation because it may provide a promise of certainty where unfortunately it's not true.
Milagros, I
would like to.
Yeah, please, and I'd like you to talk also, well, please comment, jump in anytime, but also sort of talk a little bit about the cultural aspects. Again, I come from an African American family. I have many family members who are very critical of science and suspicious of things that are recommended to them. Tell us how we can reach out to certain communities to try to combat that misinformation after you make the comments you wanted to make.
Excellent. I think, and I agree with all of you in the panel, how important it is for us to try to increase the knowledge and improving the access to information that are correctly available from important sources or our providers. But we also, like you said, being culturally sensible. Coming from a background like a Latina and Black Latina, I wanted to say that understanding that for this different background that the patients are coming, there are, like you said, misbelief. We are afraid. We have a lot of questions when we have this type of diagnosis, and especially when people have limited access to information and education, that making in a really wrong combination, getting misinformation from different sources and having our barriers, including education, access to care, or many other sources. So being sensible, culturally sensible and mindful when we have these patients. And understanding that when they are coming with some of these comments, and the best way to do that is because then the patient feel comfortable, they will tell us what kind of soft medicine they are using, what information they are getting, from whom they are getting this information. That will help us to help them to become better partners. We have coming from long way history of issues related to care for some of these populations. So it is important for us to helping them to learn from us, and also for us to learn from them, so they can open up and help us to help them. We also understand that cancer is right now, like we all know, there are so many treatment, diagnosis, and prostate, breast, and other type of cancer, even colon, that are accessible and available now that they were not 20 years ago. So many people, they don't know, and especially community of colors, that they need to understand and get better access to information, some clinical trials, so many other ways that they can become more aware and informed so they can make better decisions about their health.
I know in the Black community there is a lot of fear out there, especially because many of our outcomes are not as good as other racial groups. Yeah. How do you? We're talking a lot about sort of treatment after diagnosis, but just in terms of screening, just in terms of trying to get people in to get their colon cancer screening and get their PSAs checked and get their mammograms. Like what are you doing in your community to make sure that people are actually getting these tests done so that we can catch cancer early and treat it successfully?
Thank you for the opportunity. As an grassroots organization, our efforts are to improve health literacy and partnering with the Department of Health and different other organizations so we can create these bridges between these resources, including mammograms, screening mammogram, PSA testing, and informed decision making, and these other resources available right now for especially for the community, so they can understand better about these conditions. And at the same time, when they get a screen, we help them and transition them to that process if they have a positive diagnosis, so we can connect them to the right care at the right time, so they can we can reduce any not only access but any diagnosis not taken care of promptly, especially for community of colors, that we understand that sometimes the delay in treatment and care can really respond or result in no better outcomes. So we provide education about breast, cervical, colon, and prostate cancer. And at the same time, we connecting them with the mammography screening rates, mammography screenings, PSA testing and education for prostate cancer, colon cancer screening, and also for cervical cancer. We do also provide a pap smear and other resources in our organization. I wanted to say that many of these is in relationship with other organizations and partners like the Department of Public Health, like the AdMedTech foundations and other resources that are helping us to help the members in the community, and also by us as an organization providing this evidence-based education using community health workers. Community health workers are being recognized, I think, nationwide and even in other countries, how important it is to rely on members from the community providing tools to them so they can become important ambassadors and members that they can bring information to their peers. So the information can be trustworthy from their peers. They understand, the community that they are serving, and the most importantly is in a way that I can be easily being delivered to individuals in the community. So we are relying on all those resources so we can help our community to get better.
So it really does take a village. And has that been your experience, the both of you, that not only is it you and family members, but like what role does mental health play in that, or social workers, or other people who can reinforce the message that you're trying to give patients about what the best course of action should be?
So, I mean, it takes you are right, it takes a village, and our care team is just not a physician anymore. There's no ivory tower where one person makes a recommendation and that's what's followed, and it shouldn't be that way, but the entire environment is important, not just the physician, but the staff that we have at our cancer center. I'll often ask my patients who are interested in therapies that may not have a lot of evidence for their support to be seen by our wellness center, who may offer those types of things to them that align with their personal values and beliefs, like massage and meditation and those types of things that can help them get through their cancer better. And that way they feel like they are being heard. And again, we're doing what we can as a team together.
Anything to add?
Yeah, I mean, I guess in response to what Milagros was saying, just the importance of the messenger, I think that, those of us who in the healthcare sector, that we can do a much better job with our messaging. And, that is one of the big problems that we saw, that a lot of information that is trustworthy and does come from trusted sources is unfortunately does not have good readability or actionability for lay health consumers. So much of the best patient education information that is out there from an accuracy standpoint is written at even a college reading level, whereas consumer health information should be at, let's say, a 6th to 8th grade reading level. Much of it is also not readily actionable, where it does not tell the viewer exactly, what steps could be taken. So that presents a lot of challenges, whereas some of the misinformation actually fulfills those criteria a lot better. And so, and the other thing is, the representation in online materials. So we had a grant from the Department of Defense looking at the racial and ethnic diversity, or the representation of racial and ethnic diversity in online content about prostate cancer, wherein Black and Hispanic males have a higher risk of advanced prostate cancer. But if you look at all of the top websites and YouTube videos that come up in a search about prostate cancer, both Black and Hispanic people are significantly underrepresented. So then we went on to do both some qualitative and quantitative research around this. So in some focus groups with Black patients with prostate cancer, they described how they never saw anyone that looked like them in the online content. So some of them even thought that Black males do not get prostate cancer, or they must be at lower risk because they never see any Black faces. We also did a randomized trial where we made these YouTube videos, and they had the same script about either screening or clinical trials, except the speaker was either a Black doctor, a white doctor, a Black patient, or a white patient. And among Black adults, we found significantly greater trust in the prostate cancer content when the speaker was Black. Also, when the speaker was a physician. So again, this important imperative for experts and key opinion leaders to participate in public discourse. But just really thinking about, who is the best messenger, and is the information being presented that meets readability criteria for consumer health information.
Although soon after a recent Supreme Court decision was made, the number of applicants of Black and brown applicants dropped by like 15%. So while we're dying to have more clinicians out there that actually represent the population they're taking care of, those numbers are dwindling and not increasing. So that's a real shame. But that's really interesting to hear. I would be remiss if I did not ask whether there are any concerns with the three of you about the new administration and sort of the chaos that has occurred over the past couple of weeks in the health community, and with various agencies and websites being taken down and information being hidden. Do you have concerns that the misinformation out there will only grow, in particular when it comes to cancer treatment and screening?
Yes.
That was a loaded question. I didn't mean to lead you there. If you don't have concerns,
no, I will
fine.
elaborate. I'm happy to elaborate on that. There's a lot of concerns. I think mainly the challenges is putting individuals in positions of power who are setting priorities and policies that are based on misunderstandings around science. And that's my main concern. I think it's going to hinder our progress as a scientific community. I'll add as a caveat, in my discussions with many close colleagues and scientists around the country over the past 2 weeks, has actually infused in me a lot of optimism that no matter what happens, that they're not going to stop the collective goodwill and motivation of scientists here.
Anybody else have anything to add, or no? Milagros? Okay, no. I have silenced the entire group. Okay. We're going to were you going to say something, Milagros?
So I just wanted to say that public health is important, for all of us and for our community residents. So we wanted to make sure that everybody receive the care that they need and the time that is needed, so we can improve the care in our communities and reduce opportunity for epidemics like we saw with COVID.
We're going to turn to some viewer questions. I'm going to start with one that was submitted beforehand, but if anybody here has questions, just raise your hand and I'll call on you. This is one that was submitted by Layla, and she asks, what is the best source a cancer patient can use to investigate and compare chemo treatments, especially the new ones? Okay, we'll go to question two.
That's a challenging question. I will say that even in oncology specialties, there's a great amount of debate that occurs around the primary evidence or literature being published about certain therapies. I think the best resource that a cancer patient has in those settings are their care team, their physicians. And I think it's important to also get second opinions. I think I would always encourage patients to reach out and get second opinions from individuals if they aren't getting their questions answered about what might be the best chemotherapy for their specific situation.
I agree with all of that, that this would be the place to ask for your information, prescription from your healthcare team. I definitely agree about second opinions. Also, I think it's important to point out that the National Comprehensive Cancer Network, which creates guidelines on cancer care, does have guidelines for patients. And they are written in plain language with a lot of graphics and other visual aids, and so I think that is another important resource that can be used to just confirm, the types of treatments that are available, as well as important information about survivorship.
Is there anybody with their hands raised right now?
Yeah.
Yes.
I wanted to add this.
Sorry,
and also CDC, there are a lot of opportunities to understand more about the different type of cancer and treatment. And I see the CDC guidance and website can help as well. In addition, like we all said, the best source for information could be your medical team and your providers that are in your care. So looking for a second opinion is important, but also sit down with your doctor. And if you don't have understanding about the condition, you can also, many of organizations like Latino Health Insurance Program, we can help you to coordinate that with your providers.
Thank you. We have a question here in the front row.
Hi, my name is James Su, and thank you so much for informing us about the prevalence of misinformation in cancer care and about the effect, the size or the magnitude of its effect. But given that there's a lot of content on YouTube, Instagram, TikTok, who is creating this content, misinformation content, and what's incentivizing them to do so?
I'm just going to repeat the question in case people didn't hear it. So the question is we forgot about YouTube, I forgot about YouTube, Instagram, and TikTok. Who's creating this misinformation content and what sort of incentivizes them to do it?
Okay, I can start with that one. So fantastic question, and thank you so much. Who is creating misinformative content? There is a wide variety of sources. Now, some content that is misinformative now started out being accurate and informative. It is just now outdated. And so now it is misinformative. So one problem is that once something goes online, unless somebody actively takes it down, it just basically remains in perpetuity. And so there are very good videos, for example, on YouTube that 10 years ago described the state-of-the-art guidelines. For example, there was a guidance against prostate cancer screening by the United States Preventive Services Task Force back in 2012. Now, since that time, that has now been revised, where now they recommend shared decision-making about prostate cancer screening. But there are many videos online, both from academic university sources as well as media sources about the original guidelines saying that the recommendation is against prostate cancer screening. So that would be one example where it used to be true, but it isn't anymore. There are certainly many videos that that something was never really true. But unfortunately, there is a variety of sources. There's patients sharing anecdotal information that may be just, their N of one experience. There are commercial interests who are trying to sell a product. But in our studies, we have actually found some misinformation that is from doctors. And that can be very concerning, since these would be, some of the most trusted sources of information. So in our current study, we started to do a deep dive on who are the self-described doctors who are sharing misinformation about prostate cancer. And only one of them could we find was currently board certified in a field that may manage prostate cancer, which is internal medicine. And none of the others had a current board certification in something that was related to prostate cancer care that we were able to find in professional licensing databases. So I do think that anyone out there who is using these sources should do your due diligence. And, an anecdotal story, that may be somebody's own personal story, but their case may not apply to other people. And so this, can create false hope or be misleading for others who have a very different clinical picture.
One thing that comes to mind, I don't know if you all remember the video that went viral about tampons causing GYN cancers. It was huge. I guess you weren't on YouTube at that time, huh?
That was not in my algorithm. If I was.
Because otherwise you're on it 10 hours a day. But it spread like wildfire, and I had so many people coming up to me asking me, if I use a tampon, am I going to get cancer?
Yeah. And I think there's perverse incentives there, right? Like some people might have financial incentives if they're trying to sell a product, but if you think about how these social media companies work, they're incentivized by engagement. And what's going to get an individual engagement? Saying, hey, chemotherapy is effective and safe under these conditions, or saying, hey, rectal ozone therapy is going to cure your cancer. So again, there's things that draw engagement that I think create a perverse incentive for people to share misinformation.
Otherwise, sexy.
Yeah.
Sexy content. I thought this was an interesting question from Margie. What is an appropriate response to those who believe they are seeing too much cancer in their neighborhood, school, or workplace? Does anybody have an answer to that? Like, how would you address that if?
Yeah, that'd be a tough one. I mean, because I like to give individuals the most generous interpretation, and it's likely that maybe that is true. I wouldn't know, and I wouldn't be able to say one way or the other. I think the way that I would address that is I would, listen, and I would ask questions about, why they hold that belief. Sometimes in my interactions with patients, I like to use like this strange motivational interviewing technique where you can ask people, how sure are you that thing is true? And they might say, I'm like on a scale, 0% to 100%. And they might say, I'm 70% sure that this is true. And then sometimes I can say, well, how come you're not 100% that's true? And then you can get at some of the uncertainties they might have around that belief. And then you can do the reverse as well. You can say, how come you're not 0%? And then you can they might say, well, I believe it's true for these reasons. So you can actually develop a conversation surrounding, again, kind of these ideas around shared values that you can build upon to be able to debunk potential misinformation, or, if you can.
Yeah, I would like to add that it would be important if you have a major concern in your environment or in your neighborhood to reach out, to your representative member from your community and also your public health department. But the most important, to start the conversation if you already have those concerns with your providers, because I think they will listen to you and they will try to understand where are you coming from, because maybe this is what we are all discussing today. This misbelief and misconception can spread that can limit, community members, residents, or even families to seek the care that they need. So it is important to raise your voice and ask the questions.
Here's a question that's coming in online. Have there been any studies looking at the most effective intervention to combat disinformation? Do we know what the best approach is based on research?
So this has been a challenging question to answer, because we know that decision making is complex and behavior is complex, and it's hard to take in all the factors that go into a belief. It had been said that you couldn't just correct misinformation by stating a fact, but that's not entirely true. You can do that. I think initially there was this concern that there would be a backfire effect where they would only be further entrenched in that belief if you tried to correct it. But that's not entirely true as well. That backfire effect is not as strong as we once thought that it was. There's things that you can do. You can discredit the source of the disinformation. You can point out low credibility of a source, meaning they don't have the credentials to be able to be speaking on these things. Those things are seemingly effective. When you take all of these strategies into account, seemingly the most important thing is something that's been mentioned multiple times already, is trust. And I think the most important thing is that the individual trusts the person that they're talking to, and that's how you can address a misinformation issue.
So important to establish a relationship with your patient so that you gain their trust. We only have a couple of minutes left, so in 30 seconds or less, I want each of you to recommend 1 or 2 resources for cancer patients seeking trustworthy information. Where should they go? I'll start with you.
Great. So I mentioned earlier the National Comprehensive Cancer Network has the guidelines for patients, and that, as a urologist in the GU realm specifically, the Bladder Cancer Advocacy Network has great resources on bladder cancer. Prostate Cancer Foundation has great resources on prostate cancer, and Urology Care Foundation has a lot of also patient resources on all the GU cancers.
So if foundation's at the end, that's a pretty good bet that it's a decent source of information. Okay.
Cancer.gov is a really great resource for patients who want to get information about their cancer. That's one that I will often recommend. When patients are just looking for general advice, I will often say something similar, like, look for a .edu or a .gov or a .org. But again, even then, sometimes you have to stay vigilant about the types of information that you're looking at.
Milagros, quickly.
Yeah. Yes, I would add the same, and also, the CDC results, the behavioral risk factor surveillance survey also give you a lot of background information of different research and data that you can share, and also you can go directly to your, in Massachusetts, your, what is it called, the CHIA or these other places that you can look in online from your different communities. Like Chennai, 6, 7, they also have a lot of resources of information, your public health departments. So there are different trustworthy sites that you can go to, and also organizations like us. We always try to help individuals to understand in a way that is easier for them to comprehend. Thank you.
Thank you. Thank you to all 3 of you for being here with us today. I think it was a really engaging conversation. If you missed any part of the program, you can actually view it on demand on the Harvard Chan School's YouTube channel, very reputable. And Harvard Chan members are invited to visit the Zhu Center website to learn about additional World Cancer Week activities, including a symposium later today and a cooking demo tomorrow. Have a great afternoon, everyone.